The worst is yet to come. Returning now to the dire warning from the World Health Organization about the spread of coronavirus in Africa. Uganda is one of the countries struggling to contain a surge in cases. A third wave sweeps the continent, and it's under another lockdown at least through the end of July. Officials say the public healthcare system is overwhelmed, and some people who can't afford treatment are attempting to self-medicate at home. Uganda has nearly 90,000 confirmed cases, but the actual number is believed to be much higher because testing isn't widely available. Less than 1% of the population is fully vaccinated. Dr. Chris Baryomunsi is an epidemiologist and member of Uganda's National COVID-19 Task Force. He's also the Minister of Information, Communications, Technology and National Guidance. Minister, great to see you. Thank you so much for joining us today. I'd like to start off with the state of the hospitals right now and what you're experiencing on the ground.
Yeah, thank you very much. Like in many other countries in Africa, we are experiencing this COVID-19 crisis since early 2020 in March, and we had the first wave of the pandemic, and now we are in the second wave of the pandemic, which began just last month in June. In the first phase, we worked very hard. We had a successful national response where we brought down the infection rates, but because of the new variants beginning June this year, we got a second wave where we have lost a number of people, and there was increased hospitalization. And yes, the hospitals have a number of patients, but when we instituted lockdown and also a number of measures, preventive measures, we are now starting to see a lowering of infection rates, and also the hospitals are gradually getting decongested as many patients walk out of hospital.
I want you to give a sense to our viewers of what a lockdown means for a country like Uganda that relies on the informal sector, that already so many people are living close to the line of poverty, because many African countries can't afford to lock down and shut down economies. It's become such a tough dilemma of lives versus livelihoods.
Yes, it is a difficult decision because we have to balance between a lockdown in order to protect the population against the virus and also economic survival. Definitely, it's painful and inevitable. In a situation where we don't have access to adequate doses of vaccines, we have to ensure the public health preventive measures are enforced. Lockdown is an extreme measure of social distancing, and we announced restrictions. For instance, the schools are now closed. The public transport is also restricted, and people are advised to stay home. We only allow the essential workers to get to office, and this helps, but it's painful. It is very inconveniencing. It affects the economy negatively, but we have no option but to go that way for now.
So, Minister, do you think that we have failed to procure vaccines on the continent? And who would you say has failed? Is it COVAX that Africa relies so heavily on? I know that when we were talking earlier, you were saying you as a country, Uganda, independently as a country, it's very hard to negotiate pricing and to try and capture some of that supply chain. Have we failed?
Well, it has been a very complicated situation because as a government, we have put money to procure vaccines, but our feeling down here in Africa is that our partners in the Western world are focusing more on their population and they are neglecting the African population, and yet we are also suffering with the virus like the rest of the world. So yes, COVAX facility has tried, but I think many countries in Europe and the Western world are holding the vaccines. The supplies are concentrating in the global north, and Africa is like neglected. And our appeal is that we should discuss these issues of equity, because from a public health point of view, it does not make sense to protect one section of the population in the north, and you leave others in Africa and the developing countries with a high saturating virus, because we are going to see more variants which will undermine the protection which has been achieved in Europe and many other countries.
So when you see and you hear news that the UK is now opening up, getting rid of masks, perhaps talking about booster shots down the line, how does that make you feel as a policymaker in Africa?
Well, we feel that everything should be done to ensure that we access vaccines and we also vaccinate our population so that we can cover our people, so they build immunity, and then we can be able to allow people to freely get back to a normal situation. So we also want to move toward that way. But the challenge, like I have said, that we don't have access to vaccines at the moment.
Right, Minister, thank you very much for your time. And I know that you are working very closely with the medical team to try and get manufacturing of vaccines on the continent as well. We thank you for your time and your insights. Right, well, coming up, a decade after independence, South Sudan is still searching for peace. What can the president do to turn things around? A former U.S. ambassador weighs in. Stay with us.